Hello everyone. This is Dr. Kiran Kumar Mukku. I am a nephrologist and kidney transplant physician at Continental Hospitals, Hyderabad. So today I am going to discuss a topic called urinary tract infections. Urinary tract infections are quite common. We come across urinary tract infection at least once in our lifetime. Especially the ladies or the women, they suffer from urinary tract infection very commonly. During their reproductive years, urinary tract infections are more common. That is because the urinary tract in females is shorter when compared to the urinary tract in males. So that's the reason why the bacteria have got very good access to the urinary tract and they'll go inside and cause urinary tract infection. So the entire urinary tract of a human can be divided into upper urinary tract and lower urinary tract. So upper urinary tract consists of the kidneys and the ureters, and lower urinary tract consists of the bladder and the urethra. And upper urinary tract infections are not that common, while lower urinary tract infections are very common. So lower urinary infections are bladder infections, which in technical terms is called cystitis. Infection of the urethra is called urethritis. So urethritis and cystitis are quite common, while infection of the kidneys, that is called pyelonephritis. So it's called acute pyelonephritis or chronic pyelonephritis based on the duration. So if infection is happening now, that is in the current period, then it is called acute pyelonephritis. Chronic means that infection is there for quite some time now. So that's about chronic pyelonephritis. So there are several risk factors for getting a urinary tract infection. So for example, the gender itself. So like I was saying, the females are at a higher risk of contracting a urinary tract infection. The second thing is any urological procedure, for kidney stones, they might be doing a surgery, or a urinary catheter is being put for any other surgery. Any manipulation of the urinary tract also can cause a urinary tract infection. So this is the second risk factor. Third risk factor is sexual activity. So young females who are very active in sexual activity, they are also more prone for getting urinary tract infections. Fourth thing is menopause. So the women, if they attain menopause, the estrogen support to their genital area comes down, and this will ultimately leads to increased risk for urinary tract infections. So this is the fourth risk factor. Apart from this, a lot of people, they don't go to urination when they get the urge. That's because they might not be having access to the toilets at the right place, or they're too busy working, so they don't drink good amounts of water, and these are some of the risk factors for getting a urinary tract infection. What are the symptoms of urinary tract infection? So the first and foremost is burning sensation while passing urine. That's called dysuria in technical terms. So burning sensation while passing urine, or frequency of micturition, that is passing urine for a number of times. That's called frequency. Sometimes you may get urgency. Urgency is basically you'll have to go urgently to the toilet to pass urine. Sometimes incontinence can be there. That is without our control, the urine may come out. That's called incontinence. Apart from this, sometimes turbid urine, that is white colored urine, or smelly urine, foul smelling urine, blood in urine also can be a symptom of urinary tract infection. So once you have these symptoms, it's always better to consult a general physician or a nephrologist or a urologist, whoever is there nearby. Because if you go to a medical shop and take an antibiotic, we won't know what we are treating. We won't know what is the organism that is responsible for causing urinary tract infections. And if you take an irrelevant antibiotic, and for a irrelevant number of days, the infection may not be controlled fully, and the infection may come back again. And the bacteria can get resistance against these antibiotics. So in future, these antibiotics may be useless for you. That's the reason it's always better to visit a nephrologist or a physician to treat a urinary tract infections. So what are the complications? So if you know the complications, you will understand that prompt treatment of urinary tract infection is very important. Complications is recurrent urinary tract infections, that is 2 or more infections in a 6-month period, or 4 or more infections in a 1-year period. They are called recurrent urinary tract infections. So recurrent urinary tract infections can cause permanent damage to the kidney. It causes scarring to the kidney, and this scarring can cause kidney failure. Okay. So kidney failure in technical terms is CKD, that is chronic kidney disease. So recurrent urinary tract infections can cause chronic kidney disease. Second thing is these minor infections can get flared up, and these infections can enter the blood and cause severe septicemia. This is especially true when the patients are elderly, when they are obese, and they are diabetics. So there is a risk to the life also if this happens. That's why any small urinary tract infection has to be detected early, appropriately investigated, and treated very efficiently. So these are some of the complications of urinary tract infection. And how do we avoid urinary tract infections is, you'll have to drink plenty of water or fluids, be it water, be it buttermilk, be it coconut water or fruit juices. So any fluid is important. You can take, if you have a UTI, it's always better to take at least 3 to 4 liters of fluids per day. And whenever you engage in sexual activity, it's always better to maintain hygiene, wash yourself after the act, and maintain genital hygiene. When we actually go for washroom, it's always better to clean our genitals and avoid infections. Drink plenty of cranberry juices, because cranberry juice acts against a bacteria called E. coli. So E. coli urinary tract infections, cranberry juice consumption is very beneficial. Apart from this, it's important that we detect the urinary tract infections at the right time and treat them appropriately, which will avoid permanent kidney failure in the future. Thank you all.